Hi, my name is Gracie Monterey, and I was partnered with Paige May to present the stages of swallowing for you. The first stage of swallowing is the oral preparatory stage, and in this stage, you use 3 muscles to close your mouth and 1 muscle to open your mouth, and those muscles are what controls mastication. These muscles are the masseter, the medial pterygoid, and the temporalis. Those 3 muscles are used to close your mouth, and then the muscle to open your mouth is the lateral pterygoid. And then to moisten your food, the salivary glands are signaled by the hypoglossal nerve, which allows for the salivary glands to produce saliva and allows the food to soften up as you're chewing it. And then moving forward to the oral transit stage. The oral transit stage is the second stage of swallowing. And in this stage, your tongue pushes up on your hard palate. In your hard palate, you have bones, and in your soft palate, you don't. And so your tongue is like up here, and your tongue leans down. So the food's going down towards your soft palate, and the soft palate is signaled by the glossopharyngeal nerve to move up, and once it's moved up, that's blocking your airway so that nothing comes out of your nose whenever you're swallowing. And then the third stage is the pharyngeal stage. So as it's going down, the hyoid muscles are able to push up the larynx and the trachea, which allows for the epiglottis to fall down. The epiglottis covers the airway so that you don't get any like food into your airway. And then your cricopharyngeus, your cricopharyngeus muscle is the muscle that opens up your esophagus. So once your esophagus is opened up, then you are able to let that food go down, and then that is what starts the esophageal stage, which is whenever your food goes from your esophagus down to your stomach. So I have a visual for you. So your teeth right here is what causes chewing. So, and then your tongue is going to push up right around here, and this is going to fall back. And then as this falls back, this is your soft palate, which is going to push up and cover up your nasal airway. And then the food, say the food's coming down like right here, and then your epiglottis is gonna fall and cover, this is your airway right here. Your epiglottis is gonna fall and cover your airway. And then the food is able to go down your esophagus once that cricopharyngeus muscle is opened. And then that is what starts the esophageal phase, where it goes down to your stomach. Thank you.
Hello, I would like to just start out by introducing myself. My name is Paige May, and I do know that swallowing might be feeling a little tricky right now. So I want to walk you through how it normally works and help you understand what might be happening right now. So every time you eat or drink, your body is doing a lot to get that food or liquid to travel down into your stomach. It all starts when you chew your food in your mouth. Your teeth break the food down, and your mouth mixes it with saliva to make it easier to swallow. So when it's ready, your tongue pushes the food back to the back of your mouth, kind of like when you're getting ready to speak. And if you just swallow, you can feel your tongue go to the back. So once the food or drink gets to the back of your mouth, that's when things really start to happen. Your throat muscles tighten up and push the food down into a tube that's called the esophagus. So I'm sure that you've heard this term before, and this is what leads to your stomach. So at the same time, there's a little flap in your throat called the epiglottis. It closes over your windpipe to make sure that the food doesn't go down the wrong way and travel into your lungs. This is really important because we don't want food or liquid to get into our lungs and cause choking or coughing. So now the food will move down into our esophagus. This tube is like a long, stretchy passage that goes down from your throat to your stomach. Your esophagus muscle squeezes. It squeezes the food down like a gentle push to make sure it keeps moving. And this is a process that it doesn't need you to do anything. Your body just takes care, it just knows to do it automatically. And finally, when your food gets to the bottom of your esophagus, there's a little opening that lets food slip into your stomach. This is where your body starts breaking everything down for a process that's called digestion. So now, if something goes wrong in any part of this process, swallowing might feel difficult or maybe just uncomfortable. Because this is a process that should just feel smooth. So maybe food gets stuck, or you might cough or feel like food is going down the wrong way. That's when we will need to work and figure out what's going on and how we can help you make swallowing easier. So in closing, I would just like to say that swallowing is just a smooth, natural process. And if you find yourself having trouble with swallowing, it'll be good that we just look at it step by step and find a way to make this process easier.